we're plowing through May. It's May 19th. And I thought we probably should talk about this. We talk a lot about what's been going on currently with redirecting healthcare staff, nurses. We even talked about dental technicians coming in and helping in the labs at the hospital and the labs for this COVID, right? So doctors have been redirected out of different departments to help out, triaging and ER and so forth. We talked about nurses, the OR nurses slowing down because surgeries were canceled and so forth. So a lot of redirecting, some layoffs, some pay cuts, and some furloughing and so forth. A lot of that kind of thing. And that has been a recent issue. But an issue that has been on my mind and has been discussed for quite some time, I want to say since, I mean, it's probably been in the news through the new millennials since 2000, but more, I would say, in the last 10 years. Nursing shortage, nursing shortage, nursing shortage. And the many, many years that I was in nurse staffing personally, and then as a leader in nurse staffing, I felt that. I could never meet the needs of my clients, you know. There were never enough RNs or specialty RNs, or even on, you know, different times of the year, LVNs. And so I thought, you know what, we should still talk about that because it's a big concern. And let's just talk about the RN shortage and the MD shortage. And when I say RN, it's all kind of a big group of RNs. I kind of include the special practice certified RNs, the, excuse me, why do I get itchy when I talk? Some kind of preparing for battle kind of situation. I don't know. Anyway, so when I say RNs, I mean RNs in the broadest capacity. So nurse practitioners, physician's assistants, advanced practice RNs, that's the word I was looking for, advanced practice RNs, RNs, specialty RNs, okay? It's a big group, and we'll talk about that first, and then we'll talk a little bit about the physician shortage. And when I talk about the physician shortage, that is MDs in a variety of capacities. Family practice certainly has a shortage, and rural doctors and community doctors. Now, I should just turn the whole machine off. I do turn my sound down, but I apologize when my phone rings. So doctors, I'm talking about this big, huge group of doctors in a broad sense. When we're talking, when I give you any statistics, it's a broad one. But the bigger needs are for, I want to say, family practice physicians and primary care physicians, okay? So let's start with the nurses. The nursing shortage is massive. I will throw a statistic at you. From like 2013, we heard that there was a need for close to 600,000 nurses. And one of my last talks, maybe last Friday, I was talking about the shortage of nurse and all this redirection and so forth and jobs and whatnot. It is up to, or predicted for the next couple of years by 2022. Can you believe it's 2020? I can't believe it. The last 20 years like that. Anyway, 1.6 million. 1.6 million. We're talking, this is the U.S. This is not a worldwide number. This is the U.S. So 1.6 million. Where are we going to get these nurses? And why is this happening? So that could fill hours, actually. So I've got to kind of abbreviate, okay? There are a variety of reasons. I mean, we're busy. Our population, our aging population is living longer. Let's see. So we have this influx of patients, right? Because of aging, because the baby boomers are retiring, because even though we talk about it, it's on the news, it's on every magazine cover, it's, you know, your diet and your health, your lifestyle. It's hard to do. It's very hard to do, to eat right and live right and get the right amount of sleep and get the right amount of exercise. So no matter what we do, or when we figure it out, right, some of us are doing a good job of having a healthy lifestyle right along. You know, we had good parenting and good role models, and we did all that. We exercised, we ate right, we slept right, we were a real good boys and Girl Scouts, right? But not everybody, not all of us do that. And we make mistakes, and our body and our whole being, or psych, or mental, or physical, all of those things take a toll. So we have this aging population with a lot of health problems. You know, they smoke, they drank, they stressed out. Stress, such a big blow to the health. Overeating, overdoing, all of that, right? So so we have this growing population, this increased population, increased influx of patients into the community and into the healthcare system, and the baby boomers retiring, and why else is there a nursing shortage? There is we've talked about this before too. There's this sort of vicious cycle of the need for nurses and the need for nursing educators. So there's a huge need for nursing educators, and until that can happen, everybody's on a waiting list. So there are people in the community, either young people or, in many cases, people redirecting their careers, wanting to go into nursing, and they wind up on a waiting list because there aren't enough educators. And so we've talked about that too. And then there's this other piece of job dissatisfaction, where nurses in the field are underappreciated. They are, I know we've talked about this. This is something that's so close to my heart, and my experiences personally and with my colleagues of job dissatisfaction. They're like, you know what, I was so close to retiring anyway, and I thought, that's it. Nobody was hearing me. My patient, I didn't feel safe. I couldn't get it done. It's been weeks or months since I felt like I made a difference in my patients' lives. And so all of these factors factor in. And so we have this massive nursing shortage. It's not getting better. It's going to be more than 1.5 million in the next several years. And so it really warrants a look at, and what can we do? What can we do? Well, we have to have a voice. And and here's another piece I wanted to mention. The roles that nurses play, we started off with Florence Nightingale. That gal, you know, washed the floor, helped with the surgeries. I mean, that was Florence Nightingale, right? She worked day and night and so forth. Well, the positions that that are needed and that are in demand now are varied. I mean, when I was much younger, we didn't have nurses in retail pharmacies, in Target and Rite Aid and Walgreens. No, we didn't have those kinds of jobs. We had nurses in the hospital, and maybe some nurses in the doctor's offices. That was usually more other healthcare personnel, medical assistants, and so forth. So, but now we have, you know, outpatient surgery, and we have research clinics, and we have studies, and we have infusion centers, and there's so many areas. I think I made a note here. Let me see if I can pull it up. There's so many areas now where nurses are needed. So that has that influx of variety of positions, which is exciting for nurses. I mean, I actually wanted to be, when I was younger, I wanted to be a nurse that did it all, you know. I wanted to be the community resource nurse, and I wanted to be the ICU nurse, and I wanted to be the ER nurse, and I didn't want to do labor and delivery, and I didn't want to do psych. I thought there were people that were really good at that should do that. But I just wanted to touch so many different areas of nursing, and that was very attractive to me as a career, to have that variety and so forth. But yeah, so nurses are in homes, right? Not just home visits and the nurse that takes care of patients in the rural community, but in-home nurses, full-time in-home nurses are needed. Long-term care facilities, retail drugstores, community settings. There's a variety, I guess I did hit on them, of settings where they're needed that didn't exist a long time ago. So there's all of that as well. And so, so don't worry. If nursing is your career and you're looking for variety, it is there. For nurses, for nurse practitioners, for PAs, for the advanced practice nurse, for the LVNs, for the CNAs. I mean, the jobs are there and the shortage is real. And that's going to really take another day to discuss for our healthcare community and for our bureaucracy, for our leaders and our legislative leaders to really pay attention to. And healthcare is finally in the eye. I mean, we've been so concerned about healthcare and the cost of healthcare and the brokenness of our healthcare, and insurance is, you know, there's changes going on galore, not all good, right? So we're getting the attention we need to take a good, strong look at what can be done. And one of the things that I believe can be done is that we need to adapt, okay? We need to look at what's working, what's not working, how do we plan to improve things? Because a huge reason that nurses leave, the job dissatisfaction increase, is because they can't. What do we want to do? What's the most satisfying thing most doctors and nurses will tell you is making a difference with their patient. That's what's satisfying about the job. And if you're not able to deliver that, if you're too busy using computers and trying to get the meds you need, or trying to get the discharge planning you need to get things in order, and to balance all these balls up in the air, you know, all these patients, because of the shortage already, you're working under high demand, more patients than is probably safe. So what we need, what has to emerge in healthcare is good leadership. And that's going to come from our legislature, and it's from ourselves, the nurses, recognizing that need. And there are actually healthcare roles emerging in this time, in all of those areas, in the long-term health facilities, in the community nurse, in the pharmacy nurses. There has to be people looking at that picture and improving it. We need to foster that. Our voice, we need to be a united voice. We need to pay attention. We need to be vocal. We need to be studious and so forth, because the healthcare employers and the healthcare facilities and the universities and everybody that is experiencing the healthcare shortage has to be a part of the solution. And look to your staff now and find out what's needed, how to best retain them, how to best support them. Where are we failing them? We need to take care of them physically. We need to take care of them physically. We need to take care of them professionally, right? Listen to the demands. Okay, this is what happened the first week in March. This is what happened the first week in April. And let's not let it, here we are in May. Let's not that continue on in June. You know, we're having our monthly meetings or our weekly meetings. Listen and, you know, don't Band-Aid it. Listen and look for really long-term solutions. And I really believe one of those long-term solutions is encouraging the voice of the nurse to be part of the leadership, part of the solution. So we'll take care of them professionally, we'll take care of them physically, because the job is very physically demanding, and then emotionally, you know. Be open, be a supervisor that is open to a nurse that is distressed for whatever reason, you know, maybe personal, but you bring that to the job, you know. You keep asking me for overtime and I don't know how to say no, and, you know, my kids are sick and I feel like I'm neglecting my husband, and, you know, I'm overwhelmed, you know. Listen, talk, resolve. So it's going to take a village to resolve some of these things. But yeah, healthcare is okay. Healthcare is a group of people. People as a group become a culture. So our culture has to change, right? We keep saying nursing shortage. I have heard about nursing shortage, I want to tell you, since about the early 2000s, right? But it's so really strong. And as we got past 2010, 2012, into 2013, and here we are in 2020 with our crisis and stuff. And what better time when everybody is alerted? I mean, it's a tough time. I know it's a tough time. I see disappointing things. I hear disappointing things about what's going on and how we're forever changed. My new little grandchild, who's barely 8 weeks old now, sees everybody in a mask other than us in the household. Thank goodness we're a household of 4. With her, it makes 5, right? But yeah, if people come to the door or we go for a little walk, all the faces she sees, including the ones she came into the world seeing, the doctors and nurses, everybody's masked. Nobody takes those masks off. What a world, huh? Okay, so we're talking about shortages. I don't want to leave the doctors out, our precious doctors. But keep in mind, I said, by the year 2022, that's very around the corner, guys. It's May 2020. We need 1.6 million more nurses. We need them. We really do. We need nurse educators. We need nurses. We need them, need them, need them. And that does not actually include the advanced practice, the PAs and the nurse pracs, okay? The NPs, the PAs, and the AP, what do we call them? Advanced practice RNs, APRNs. That's just, I'm just talking about RNs in that group. So now we move over to the physician group. And the physician group, it's different. There's a world of difference between the nursing shortage and the MD shortage because, as you can see, a doctor comes in, he has his lineup of patients. Excuse me. For example, if he's an OB doctor, he may have a couple of patients in labor, a couple of patients postpartum, prepartum, his OB, his GYN patients. So he's got them sort of scattered about. 2 over here, 3 over there, 1 in labor now, going back to the office, going to see another 70 patients. But the nurses are sitting with numerous patients at a time on the wards, in the offices, in the community. So there's that number variation that's going on there. So regardless, the population growth, we have that in common. The aging population, the population growth in general, and the baby boomers retiring. So all of those things, all of the health factors, the stresses and the smokers and the obesity and the diabetes and so forth, we're dealing with all of that. And so that is another reason for the need for physicians. And the interesting thing is the huge need for more nurses, that over 1.5 million, right, is not the number we're looking at for physicians. The physicians And the need for physicians and a projected, this is information I got from the American Association of Medical Colleges, is that at least or greater than 90,000 physicians will be needed in the year 2025. So we're working on a different scale. And then, 90,000 versus 1.5 million, 1.6 million. But it is growing too. It's not going down. They predicted for the next couple of years up to 2032, that we'll need at least greater than 122,000 physicians. So although that isn't 1 million or 1.5 million or 1.6 million, it's still a big number, and it still warrants looking at what's occurring. Is there enough money out there in the medical community for educators of the doctors? And is anybody doing anything about job satisfaction for the doctors and so forth? So I think that legislators, or leaders, or government leaders and so forth have traditionally supported, and there's been a lot of lobbies for groups like the AAMC, the American Association of Medical Colleges, AAMC. So they have traditionally and for many generations been better supported. Their education and their medical colleges have been better supported. But is that a place to look? I don't know. But I know that I don't want to be somebody around when there's no doctor for me. And I think some of the things that apply for the nursing shortages do apply for the doctors too. There are different, they're being pulled in a variety of directions. If there are nurses and personnel in the pharmacy, in the Rite Aid and the Targets, right, then there has to be a doctor directing there as well, or at least a PA. So the shortages occurring for RNs is massive. There's also a shortage of physician's assistants, nurse practitioners, advanced practice RNs, and MDs. There it is. It exists. We need to see that our culture is changing, be part of the solution, make sure we have a voice, and you have your supervisors and your leaders, and if you're not getting anywhere, if you're not being heard, then Medical Jobs Channel understands. That's why we are here, and we are a place where employers and employees can find each other, and you can talk culture, when you have your interviews. What is the culture? When you support somebody in their position, how do you support them? It's just not a paycheck and benefits. Yes, that's important. You have to be competitive. You have to look at that. But do you give them advanced education? Are they being kept as things like with this COVID? So many things have changed. Do we need updates on our PPE, right? Our personal protective equipment? What's needed in this department? What's needed in that department? What works? What doesn't work? How are we going to get educated? Will we get paid when we come in for those classes? These are really important things in the culture of your facility or office or community health, things to look at. Things to look at, to share, to understand one another and work together. Yeah, there are shortages, without a doubt. 1.6 million by 2022. We need nurses. We really do. So I've blabbed on enough, I think. I don't want to be too blabby. I think I've talked about this before. I've talked to our IT, and they keep telling me it's coming. But I'm hoping that you can tune in, and I can see you, and I can say, hey, David, hey, Ann, hey, and Nancy, thanks for tuning in. Maybe I'll see some people that I know. But, where you could say hi, or you could say, talk about this or talk about that. I'd like to respond in real time. But until that, until that happens, my email should be coming up, and that's Rita@medicalJobsChannel.com. Can you email me anytime, day or night, and I will respond. And yeah, there's shortages, but that's good news too, right? And, you know, if we can change and change for the better and recruit. We traditionally, for many, many years, have not recruited nurses and doctors right out of high school. It was back in the day, you know, for me, it was really a forerunner of a career. You know, doctors, nurses, no. What is it? Doctors, Indian chiefs, or something like that. But yeah, most of the people I knew were either going into law, medicine, healthcare, and teaching. Those are the big jobs. I mean, I didn't really know much of anything else. We didn't have a lot of guidance. We had guidance counselors, but not career counselors. You know, now the careers are so multifaceted. And I do think the CSI and some of the romantic things we saw on television, they got really big. Oh yeah, policemen and firemen, always. So, but the careers are huge, huge now, especially with all our social media, television, and Hollywood and movies and so forth. The trickle down of all the different jobs. But traditionally, this job, this healthcare world is not going away. It's important, it's noble, it's needed, and the numbers are going up. So that's what I wanted to talk to you about today. Have a great day. Today's Tuesday, the 19th of May, and I'll be back on Friday this week, whatever day that is. Add 3 days, right? Tuesday, Wednesday, Thursday. No. I'll be back on the 24th, I believe. And 23rd? Oh, good grief. The 22nd is Friday the 22nd. At any rate, I'll be back this Friday. And most Tuesdays and Fridays, you can find me here between 12:30 and 1:30, getting a video chat in. And I appreciate you checking in, and I'll keep thinking of things that may interest you. They do interest me, and they're important to our healthcare community. So thanks a lot. Bye. I got the wrong mouse in my hand. Have a great, great week. See you Friday.